And now on the line is Breda Gahan from Concern. Breda is a Senior Health and HIV and AIDS Advisor with Concern. Breda, welcome back to Near FM.
Good morning, Darren. Yes, hard to believe 12 months have passed since the last World AIDS Day on December 1st, which is tomorrow. I can't believe it. And hello to all your listeners. And thank you, Darren, for reminding all of us on this important day and every day, important for preventing HIV transmission. Even I'm staggered when I see the statistics. Almost 3,600 new HIV infections are transmitted every day last year.
Okay, we'll come back to that in a few minutes. As you said, Breda, this is our first interview on Near FM since World AIDS Day of this time last year. And I also interviewed you in August of last year about last year's International AIDS Conference and also talking about the Global Alliance to end AIDS in Children by 2030. As it has been a year since our last interview, Breda, could you start off by giving our listeners, for those who don't know, a bit of a reminder of what your work with Concern entails of, and tell us then, how the last couple of years with COVID and the conflict around the world has impacted on the fight against AIDS?
Sure, Darren. And before I get on to that directly, I need to remind people that actually this year marks the 35th year of World AIDS Day, since it was first nominated in 1998 to maximize education and publicity on which then was a growing HIV and AIDS epidemic, the first cases having been diagnosed in the USA in 1981. And the theme of that year actually was what you're doing right now, communication. And that year also, you'll often see me wearing it, the red ribbon became the global symbol for solidarity with HIV positive people and those living with HIV and AIDS. And like I said, the figures, ongoing, I check them every year. The UNAIDS latest report is just out. But since the onset of the epidemic, which is 42 years ago, 86 million people have become infected with HIV globally, and over 40 million people have died from AIDS-related illnesses. It's hard to keep those statistics in your head. When I read them, I recheck to see if they're still true. Now, positively, new HIV infections have been reduced by almost 60% since the peak of the epidemic in 1995, and I know we'll talk about it later on, when antiretroviral therapy became available. But for 15 very sad years, there was no treatment available from the early 1980s to the middle of the 1990s, and everybody with HIV died. Yes, I'm Darren, as you mentioned, I'm a nurse and midwife firstly from the Mater and Coombe hospitals trained. I first worked on HIV and AIDS as a nurse in St. James's in the late 80s. We all knew very little about HIV and AIDS at the time. It was new to us as everybody else. Before treatment, sadly, everybody died. It was incurable, and often it was quite young people, as young as myself in my early 20s at that time. It was very challenging for all the teams supporting in St. James's Hospital. And, we won't forget the bad times, and now it's great to see the better times in Ireland. But too many people have died since the first reports of HIV and AIDS in Ireland in 1982. I was just checking, you asked about COVID, yeah. There was definitely interruption in terms of services and treatment for HIV and all services. So actually, there were lower rates of HIV reported during the COVID-19 pandemic in 2020 and 2021, followed by an almost 70% increase in diagnosis in 2022, following the 21-22, following the return to more or less normal testing and treatment services. But last year alone, there were 884 new HIV diagnoses in Ireland, about 2.5 cases diagnosed each day. There were 9 AIDS-related deaths reported in Ireland last year. 2 females and 7 males. And I just looked up the data from HPSC, the Health Protection Surveillance Centre, which reports the Irish data every week. So yesterday was week 47 this year. This year, an additional 854 new diagnoses to HIV were diagnosed till yesterday. So AIDS is certainly not over in Ireland. But in terms of my overseas work, I joined Concern in Sudan in 1988. So like World AIDS Day, I'm also marking 35 years working with Concern teams since I started in Sudan in 1988, followed by 3 years in Cambodia, 3 years in Mozambique, did a master's in public health in Liverpool University, and have spent a lot of time since in countries like Bangladesh, Rwanda, Liberia, Kenya, Sierra Leone and Sudan, working on health and HIV. And in our concerned countries, we're following the theme this year of letting communities lead, and working with communities on the response. And of the countries where Concern is working, I think you remember this from last year, Darren, that Malawi remains the highest burden country where Concern is working, with an adult HIV prevalence rate of over 7%. Higher for women than men, as always based on the gender and risk factors for women. But Concern Malawi has been working in the rural districts with the government on revamping the community support groups, of which 88 groups so far have been re-established, and meetings have been held to, again, remind people HIV is still here, to increase awareness and education on transmission of HIV. In Kenya, a neighbouring country to Malawi, HIV is streamlined under the Health and Nutrition Programme, again achieved working with community health workers, undertaking household-level messaging on prevention and management of HIV and AIDS. Even in Asia, community-level volunteers in Bangladesh play a vital role in increasing family and personal level awareness and knowledge on HIV prevention. And based on surveys we've conducted, knowledge has increased on prevention based on efforts with our target communities. Young people are really important, and Concern has supported youth peace clubs in Burundi and Rwanda, where life skills are delivered and include trainings on topics including gender, equality, sexual and reproductive health rights, HIV/AIDS prevention and hygiene. Irish Aid is one of Concern's main donors, and in Liberia, through our Answerim program, it's called, Accelerating Nutrition and Sustainable Agriculture, the HIV response is integrated throughout all the activities through the We Are One platform, again increasing knowledge and awareness on HIV and AIDS among community members. Likewise, in neighbouring Sierra Leone, the Irish Aid funded programme is also supporting adolescent sexual reproductive health life skills awareness to increase knowledge on transmission and prevention of all sexually transmitted infections, including HIV. A country close to my heart, given that I started there in 1988, is Sudan, and even in the turbulent situation in Sudan, the Concern team is supporting on community outreach education through routine health service delivery with our Ministry of Health partners, and we're supporting integrated treatment services in 3 of the rural hospitals. You asked about the COVID and conflict, and sadly, this is the context, I guess, of the HIV and AIDS epidemic in the last 3, 4, nearly 5 years now, Darren. And certainly treatment globally was disrupted during COVID-19. And even in 2022, still poorest people often do not have access to life-saving medications due to the clinics in poor countries not having them, or the cost of going for treatment. Certainly the conflict in Ukraine, and anywhere there is a conflict, as we know in Central African Republic, South Sudan, disrupts routine health and HIV service delivery, and this impacts on early diagnosis and treatment. And we've all learned over the years that HIV testing and counselling is the gateway to treatment, care and support, and to live positively with HIV, where now, thankfully, life expectancy is the same as you, me, or anybody else. But I have to say, thinking about Palestine, Israel at the minute, also sadly, the amount of people affected, impacted, the amount of deaths. But any money spent on war or conflict is not available for health service delivery, health systems, paying health workers, making sure medicines are available in the right quantity at the right time for people in those countries. Inflation is the latest disruptor, I guess, here in Ireland and everywhere. And certainly inflation has impacted on budgets. There are increasing costs, like I said, for people attending for HIV and AIDS services. Transport costs have gone up for them. Time, food costs on the way, and especially again for urban slum or remote rural populations. Globally, there is some good news that around 60% of resources available in 2022 were sourced domestically, compared with around just half, 50% in 2010. So host governments where concern is working are increasingly taking up the mantle of financing their own health and HIV responses, which is very good. But there has been a reduction globally due to declines in both international and domestic funding last year. The funding of the US government was down 3% lower last year than in 2021. And likewise, due to the currency disparity against the dollar, domestic funding is diminishing in the countries where we're working. It's reported in the latest UNAIDS report that there is an estimated 90% funding gap for HIV prevention programs among people from key populations compared with the funding that is needed by 2025. And I see this everywhere, Darren, in terms of health, nutrition, HIV. More money is spent on the Band-Aid treatment approach, much less on the preventative health education and preventing outbreaks of all infectious diseases, including HIV, cholera, dengue, hemorrhagic fever, measles. I've just come off the Sudan Ministry of Health Global in-country health cluster call, and these outbreaks are continuing due to lack of paid health workers, lack of investment. So I think going into 2023, unless there's greater investment, there will be a crisis in terms of reversing the response.
Okay, Breda, is there any more news since last year? Last year there was the launch of the Global Alliance to End AIDS in Children by 2030. Is there any more news with that, do you know, since last year, Breda?
Yes, Darren, I looked up the latest report. Some progress is made, more to do, like everything else. The report has a subheading, time is running out, just 6 years, 1 month and 4 days left to achieve this important goal. Positively, and I'm a midwife, as you know, that 81% of pregnant women living with HIV were receiving the antiretroviral life-saving medication in 2021. However, just over half, 52% of children living with HIV are currently receiving antiretroviral therapy. And in 2021, there were almost 200,000 new HIV infections in children. The pediatric formulas for HIV for children are more expensive to make and not available in the quantities needed in the countries, especially in sub-Saharan Africa. The number of children on treatment hasn't been increasing, and likewise, there are almost 500,000 adolescents, young people 15 to 19 years living with HIV, who are not on treatment. They might have not been tested due to stigma, discrimination, silence, they don't think they're sick, or because they're young, it's always harder for teenagers and adolescents, including here in Ireland, to access and go for health services alone. But the work is ongoing in terms of promoting early testing, closing the treatment gap, preventing new infections, and addressing the rights and gender issues of young people, adolescents, and children living with HIV. As we come up to excuse me, World AIDS Day tomorrow, in fact, now, like I said, the theme is let communities lead, and the strapline from UNAIDS is the world can end AIDS with communities leading the way. Certainly young people should be at the forefront. Organizations of communities living with and at risk and affected. And in Concern Worldwide, we've learned over the years, even before treatments were available, working with local HIV support organizations, people living with HIV, directly affected communities, they know how to address the issue. The solution lies within. Concern has been responding in the early days in Uganda with the Medical Missionaries of Mary since 1987, employing a community-based approach, working on home care outreach with people, sadly, who were then dying of AIDS before treatment was available. Thankfully, the situation has improved globally and in Uganda and other countries with the introduction of antiretroviral medications in the mid-1990s. But this World AIDS Day, again, concerned teams from Bangladesh, the Democratic Republic of Congo, Ethiopia, Liberia, Malawi, Pakistan, Bangladesh, Ethiopia, they're all marking World AIDS Day tomorrow, organising community walks, mass sensitization, theatre activities, marking it with host ministries of health, youth organisations, question and answer sessions on radio, all to mobilise and alert people to the fact that the invisibility, thankfully with the treatment, does not mean that HIV and AIDS is over. And we need to continue the response going into 2023 and up to the Sustainable Development Goals.
Yeah, you mentioned the Sustainable Development Goals there, and we were talking about the Global Alliance to End AIDS by children by 2030. The year 2030 really is a big calendar year for the global health community for a couple of big reasons, isn't it, Breda?
Yes, Darren. Hard to believe that the Sustainable Development Goals, or the Global Goals as they're called, for listeners, are a collection of 15 interlinked objectives designed to reach a blueprint for peace, prosperity of people and the planet to reduce extreme poverty. They were agreed by the United Nations countries, including Ireland, in 2015. So hard to believe that time has passed. Goal number 1 is no poverty. I don't think we'll reach that one. Hopefully we'll get to no extreme poverty by 2030. Goal 2 is zero hunger, both of which Concern focuses on. Concern having started in Biafra in 1968 in response to the famine there, and then in Bangladesh in 1972. We are also supporting on SDG, Sustainable Development Goal 3 as it's called, good health and well-being. The Sustainable Development Goal 3 thankfully focuses on well-being, living positively, and SDG 3 particularly focuses globally on ending the epidemics of AIDS, tuberculosis, TB, and malaria, and other related communicable diseases by 2030. The global aim by all of us working in this area is to achieve universal health service coverage for these diseases in terms of testing, treatment, and affordable medications and vaccines for all. I mean, progress has been made. Again, I looked up the data. 146 out of 200 countries are on track to meet SDG target on under 5 mortality. So less children under 5 are dying in 146 countries now compared to 2015. And again, in terms of HIV, effective treatment has cut AIDS-related deaths by over 50% since 2010. I mean, this is an amazing, what would you say, miracle of health success. Who could have imagined that AIDS-related deaths would be cut by over 52% since 2010 due to the development and distribution to the people who need them of antiretroviral medication, including here in Ireland and globally. But, inequalities still exist, especially the extreme poor, the rural poor, people in the urban slums, and we need to do more to make sure that essential medications and vaccines get out to the people who need them.
Okay, we're recording this interview, Breda, on Thursday the 30th of November, and World AIDS Day, as you said, is tomorrow, Friday the 1st of November, and this interview will be played on Near FM on Sunday the 3rd of December. But the Father Michael Kelly lecture is on tonight, Thursday the 30th, isn't it? Could you tell our listeners more about that?
Yes, this evening, hosted by Irish Aid and the Irish Global Health Network, Darren, again focusing on the UN AIDS World AIDS Day theme for this year, Let Communities Lead. I knew Professor Father Michael Kelly for many years, sadly departed a couple of years back. He was an educator, a lecturer, Tullamore born, worked tirelessly in Zambia and other countries on spreading the message of prevention, treatment, dignity and support for people infected and affected by HIV. I always remember he said that education is the social vaccine. Children need to have accurate information at a primary school age level on how to protect themselves in terms of how HIV is transmitted, how it's not transmitted, the need to go for testing as necessary, and the whole area of protection of children in school. I'm concerned, like I said, integrates HIV and AIDS knowledge messaging in all our sector programs, education, health and livelihoods, and in emergency contexts like Yemen, Sudan, Central African Republic currently. Support to the protection of girls and women, given their risk, is especially important. In sub-Saharan Africa still, adolescent girls and young women were more than 3 times as likely to acquire HIV than their male counterparts of the same age last year. And again, another terrible statistic. Every week, 4,000 adolescent girls and young women 15 to 24 years become infected with HIV globally. I hate to be given more statistics, but in terms of all adults and children, I think I said earlier, 3,600 new infections every day. So yesterday, today, tomorrow, Friday, Saturday, Sunday, every day globally, 3,600 new infections. And yet, technically, HIV and AIDS is 100% preventable. So, Darren, it's not over yet, unfortunately. And our aim is, in concern, to join with all our partners tonight and tomorrow and going forward in Irish Aid, DOCUS, Alliance 2015, and especially our host government countries from A to Z, as I said, or A to Y, Afghanistan to Yemen, and our ministries of health to end the AIDS by 2030. HIV, we have to keep positive, and for me, I keep reminding myself that HIV can also stand for Hope is Vital, HIV. So thanks a lot for marking World AIDS Day 2023, falling on the 1st of December tomorrow, Darren. And much thanks to all your listeners for the support to Concern Worldwide and our work in the countries where we're working. And given that tomorrow is December 1st, I think I can wish everyone now a safe and happy festive seasons coming up and all good wishes for 2024. Thanks, Darren.